Dr. Colin Green says the strategy is focused on things that they know work in fighting the pandemic, and today we asked him about the plan.
It's time to go to work.
A new administration in Richmond, but a familiar issue, the COVID-19 pandemic. Governor Glenn Youngkin has released his COVID action plan and an executive order to accompany it.
I have it right here, and unlike most government documents, it is exactly 3 pages long.
Dr. Colin Green is the new acting health commissioner, awaiting confirmation by the General Assembly. In his role, he'll oversee the Virginia Department of Health and the execution of this plan.
The governor's interested in focusing efforts on things we know that work.
Green says that includes things like giving hospitals flexibility in addressing staffing shortages and hospital bed capacity, and adding resources to convince the unvaccinated to get vaccinated. There are also new guidelines on testing, which, as we've reported over the last month or so, it's been hard to find a test.
It's a scarce resource, and the governor's intent is to see that we make the best use of it.
The governor is discouraging asymptomatic people from getting tested, telling healthy people with minor symptoms to isolate at home and use discretion on getting tested, and prioritizing high risk and other groups to get the tests that are available.
As test supplies increase, we can do more.
Local doctors we spoke with say they agree with the plan.
We agree. We don't advocate mass testing events. We test people with symptoms.
The tests are in limited supply right now. So actually, we have to do it at my office because we only have a limited amount of tests.
And then there's the question of the governor's separate executive order allowing parents to opt their kids out of wearing masks in school. Dr. Green says he supports the order. He didn't want to wade into the politics of it, but says it's important to view this debate by also taking into account things like a child's mental and spiritual well-being.
All of those things need to be considered alongside the disease counts. The governor is feeling this that in the case of a child, the best person to make that assessment is the parent.
And so there are 2 lawsuits against Youngkin and that mask order, and as of right now, those 2 cases remain in court unresolved. Live in Norfolk, Brendan Ponton, News 3.